These are medical articles from scientific journals. They're respected. I mean, this information is out there. It's kind of, I gathered everything and wrote about the disease that we all should know about, and then given references to back up. I'm not making this up. It's not just what I'm seeing in my own practice. There are cases. The reason, let's back up so your viewers will understand this part, is that the reason why it's so important to diagnose B12 deficiency early is because if you don't, you can cause neurologic injury that can be permanent. You need vitamin B12 for the myelin, and the myelin is the fatty protective coating that lines our brain and our spinal cord and the nerves. So if you have a B12 deficiency that goes undetected and untreated, you can damage the myelin. And what that causes is you can get neuropathy, like numbness and tingling, prickling sensations to your extremities, your feet, your hands, your legs. It can be in your trunk. And as this progresses, it can cause balance and gait problems. So if you have this neuropathy and balance problems, it causes dizziness, it causes mental status changes, forgetfulness, kind of foggy thinking. It can actually go up to like dementia. But when you look at all these signs and symptoms of what it does to the nerves, especially in elderly people, healthcare providers think, well, that's just a normal part of aging. You should be falling. You should be kind of, getting forgetful, have some numbness or tingling. And what this B12 deficiency does, it frequently causes falls, fall-related trauma. Fall-related trauma is one of the number one causes of death in people over the age of 65. So it's very important that we screen patients. In fact, it kind of, to me, doesn't even make sense. So not only is this like we need to do this for people to keep them living and for their health, in the same token, we are wasting billions of healthcare dollars by not addressing B12 deficiency or treating.
I love that you laid it out, what you just said, also in the book. It doesn't pay to ignore this.
Exactly.
It doesn't pay in the system. It doesn't pay with patients. Not tending to it degrades everybody and the entire system.
It does. And the frustrating part is that, a lot of disorders or diseases, they don't have a cure. This does. Not only does it have a cure, but it can be prevented in some groups by proper and screening. So it's kind of like we're not saying, I think that there are certain groups that should be screened, but absolutely if you have signs and symptoms, you have to be tested. And for them to, it's negligence and it is malpractice. For your viewers to really understand, I think a lot of physicians and healthcare institutions, they think of B12 like, it's a vitamin, just go take one, and they think it's very simplistic. They have to realize that, the B12 is one of the 13 vitamins our body needs for health and life. If you do not have B12, if we were to take out your stomach and wipe out your B12 completely, in years you'll eventually die. Okay, and everybody's different because it depends on your body stores. But that's what pernicious anemia, pernicious means deadly anemia. Eventually, a B12 deficiency will lead to death because you need it to live. So we're missing the importance of B12.
You say that B12 has kind of its own metabolism, if you will, and it requires gastric acid. And therefore, vegetarians are at risk of B12 deficiency, and so are people with autoimmune diseases like Hashimoto, etc. I'm almost vegetarian. I eat some meat and some fish, but it's not much. I also have to take thyroid. But vegetarians will say, well, look, I get folic acid from eating a lot of salad and a lot of vegetables and everything. And then you say that folic acid can mask a B12 deficiency. Can you explain some of this for us?
Yeah, folic acid is a B vitamin, so is B12. There's like several B vitamins, but B12 is completely different than folic acid, different than B1, thiamine, B2, B6. Okay, there's a whole bunch of different B vitamins. You can't compare B12 to folic acid because they're totally two different vitamins or substances that our body needs for health and for life. Okay, totally two different things. B12 is only found in animal products, which is meat, organs, meat, shellfish, fish, eggs, milk, cheese. Folic acid is only found in grains and vegetables, fruits, vegetables. So they come from two different sources. The number one reason people have a B12 deficiency is typically not from their diet, but from a malabsorption problem. And many people have different malabsorption problems for a variety of reasons. B12 of all the vitamins is the most complicated vitamin. It just doesn't go through passive diffusion like the other vitamins. It has to follow a chain of events for proper absorption. You have to have a healthy stomach, which secretes hydrochloric acid, an intrinsic factor. Your pancreas has to be working. And the last step, which is critical and essential, is the ileum, which is the last part of the small intestine that has receptors that bind with the intrinsic factor and then converts it to go through the body for your body to be able to utilize it. So if you have a surgery or disease of the stomach or of the small intestine, you're going to have a B12 deficiency. The problem where vegans and vegetarians get problems with is that they have lower stores because they're not taking in the food. B12 you don't make in your body, you have to take in the food. So the people who don't have a malabsorption problem, if they are strict vegans, they're going to get a B12 deficiency over time. We have found many vegetarians who do take little, B12 of fish or little parts, their levels are lower, okay? And in time, say if they're a practicing vegetarian for 20, 25 years and they're not supplementing properly, they're going to become B12 deficient. Now, what creates the deficiency to come on sooner is that if they have a risk factor, for instance, say they take a drug that can deplete your B12 stores, or they were given an anesthetic. There's one called nitrous oxide. Nitrous oxide is like laughing gas, and they use it, dentists use it a lot, but they also use it in regular surgeries. That inactivates B12 in your body. There are drugs for diabetes called metformin or glucophage. They know over time it does something to the ileal receptors that people become B12 deficient from it. Proton pump inhibitors like Prevacid, Prilosec, omeprazole. Those are drugs used to suppress stomach acid to treat ulcers, gastric reflux disease, and physicians prescribe those like candy. So you create a achlorhydric or no acid environment in the stomach, which decreases your chances of absorbing B12 properly. So the biggest problem vegans and vegetarians get into trouble with is they have this history of being that and not saying that vegetarian diet is good, but you just have to, and you can supplement with over-the-counter supplements like sublingual B12. So they can still do that. But the problem is they're taking not enough B12 for health. And the big problem they have is when the women who are pregnant and have children, their stores are lower than most if they're not supplementing properly, and prenatal vitamins do not have enough B12 to correct a deficiency, and they are giving offspring that they're lower in B12 and having problems. And you can cause developmental disabilities in infants and babies and fetuses in the womb if they do not have enough B12. So it's critically important. That's why they are at risk for B12 deficiency, because it depends on how long they've been a vegan or vegetarian, their other medical history that could lead, or risk factors that could lead them to be more B12 deficient than others. Now, physicians, and I've read this in medical textbooks, that you only have to be careful of strict vegans for B12 deficiency. That is not true. Vegetarians have a higher incidence, and they always should be screened. There is a woman in Alabama who was a lacto-ovo-vegetarian for like 25 years and had a child that was severely B12 deficient. And this child now has a severe developmental disability that he will have for life because his B12 was severely low. And unfortunately, we don't screen adults in America right now for B12 deficiency, let alone infants and children. Pediatricians do not even understand B12 deficiency in infants and children, so they don't screen them at all. This child was highly symptomatic for B12 deficiency. He even had laboratory abnormalities that showed he had a B12 deficiency, and they all missed it chronically for 2 years. And he kept getting weaker and weaker. The child almost died, and what the end result was, he did have a severe B12 deficiency, but there's a critical window of opportunity to treat B12 deficiency, or otherwise the patient will die, or you'll cause nerve injury, which also means not just your fingers and legs, but also brain injury. And that's what this child has. He has a brain injury from a